First day after shoulder replacement is probably one of the easier days if the block works. So what a block is a regional anesthesia in addition to going to sleep, and it's a shot in the neck that's guided by ultrasound and done by the anesthesiologist, and it is a matter of making the whole arm pretty numb so that you get ahead of everything and that first day is not miserable. After the first day and the block wears off, some people really don't have any pain, but a lot of people experience pain. Shoulder surgery can be painful. It's usually pretty well dealt with Percocet and ice. Staying upright, not laying flat, often helps. So nighttime or sleeping, if somebody tries to sleep laying flat in bed, is often difficult because the arm tends to move around without the effect of gravity helping it. So I recommend sleeping in an easy chair or up against the wall with some pillows behind your back. When you're up and about, not too bad. Sort of staying ahead of the pain with narcotic is probably helpful for a day or two or three. And then as you become more comfortable, weaning off to Tylenol or ibuprofen. Trying to get back in the normal swing of things. Post-operatively, if you're taking pain medication, there's a couple things that really need to be watched. Probably the only thing worse, or one of the only things worse than being in pain, is to be in pain and then throw up at the same time. So I would encourage you every time you take a pain pill to get some kind of solid food in your stomach with it. And the other thing about the narcotics is that they will bind you up. I'm not going to go into graphic detail about that, but not a bad idea if you start feeling a little bloated or anything like that to take a stool softener or some prune juice or anything that works for you at home. So in general, after surgery, I will use what's called an Ioban dressing. So it's got iodine and it's impregnated into almost like saran wrap, and it's then an adhesive, and that goes over the goes over the incision, and that allows you to take a shower right away if you want. It's waterproof. I usually ask patients to leave the dressing on for about 4 days. By then the bleeding should have stopped. The incision itself should be fairly well sealed at 24 hours if it hasn't continued to drain. So showering is really as soon as you're comfortable. Having the sling off to shower and letting the arm hang down to splash some water under your underarm to freshen things up, no problem. Driving, I usually tell people it's more at their discretion. They should probably be off their pain medication, and I would recommend trying to maybe go drive in a parking lot in the evening with your spouse, significant other, or friend to make sure you're comfortable. And when I say comfortable, I'm not talking about not having pain, but if a child were to run in front of your car, do you think that you have the reactions to be ready to stop? If the answer is yes, you're probably fine to drive short distances. Give yourself a little independence and feel more like a real person again after surgery. If you're hesitant, that's probably your way of knowing that you're not ready yet. So one of the big things about shoulder surgery is that the hand sits in a dependent position. So it's lower to the ground, so to speak, than where the incision was. And so swelling tends to follow gravity, and you get a lot of black and blue down towards the elbow and swelling down into the hand. And it's much easier to deal with it proactively than to try to chase after it after the hand gets real swollen and stiff. So as the hand gets swollen or starts to get puffy, it's best to keep the fingers moving by making fists or squeezing a ball, things like that. Not uncommon to see some bruising across the chest wall because of the interval or the muscle, the space between the muscles where we're working allows bruising to go there. So sometimes it may look alarming, but it really is pretty normal. And then the quicker you can get back to doing things and trying to live a relatively normal life, the better off you are. I mean, you're gonna be in the confines of a sling or some discomfort, but trying to get back into a routine is good. I hope that this short video is helpful and answers any questions you might have in the post-op period. Certainly, as I said, we are available all the time. There's always somebody at Tucson Orthopedics on call. Obviously, if it's not an emergent, the doctor on call would prefer not to get that call at 2 in the morning, but there is someone available to answer urgent questions 24/7. And certainly during the work week, I'm available with my medical assistant or my physician's assistant. One of us is available to take your calls and answer your questions. Please keep in contact.